Okay, so we've just gone 10:30, so I think we'll make a start. So good morning, everybody, and thank you for joining us for today's Leadership Matters conversation, supported by Northamptonshire Health and Care Partnership. My name is Alex Ridley, and I'm one of the Workforce Programme Managers for the Northamptonshire Health and Care Partnership. Just a few house rules before we start, just to remind you all that your microphones and cameras will be turned off during the content of the conversation, but obviously we'll be able to turn them back on at the end of the chat so that we can ask some questions and have some conversation. If you did want to drop any comments in the chat box during the call, please do so. If you had any questions, then we can pick them up at the end of the conversation. So I'm delighted to announce that we are joined today for our conversation by Bruce Daisley, who has previously worked as a top executive at Twitter, YouTube and Google for Europe. And Bruce has been named one of the Evening Standard's 1,000 most influential Londoners and one of Debrett's 500 most influential people in Britain. Bruce's main area of interest is around what work and office culture look like in the 21st century, and he advises on how all levels of staff within organisations can build a more motivating and productive workplace culture. He's also very well known for his book, The Joy of Work, 30 Ways to Fix Your Work Culture and Fall in Love with Your Job Again, which has been on the UK best-selling business hardbook. It became the UK's best-selling business hardbook of 2019, has been translated into 13 languages and was longlisted for Business Book of the Year and CMI Management Book of the Year in 2020. Alongside that, Bruce hosts and runs his Eat, Sleep, Work, Repeat podcast, which also focuses on workplace culture and has been #1 in the Apple Business Podcast chart. I'm delighted Bruce is joining us today to discuss the foundations of great workplace culture and how that can apply to all of us within our workplace. And we'll be doing a presentation on that for us now. And as I said, at the end of Bruce's slides, then we'll be able to take questions. So over to you, Bruce. Thank you.
Thank you so much. And look, you know, I want to sort of give a little health warning right at the outset. Firstly, you know, even though I've worked at technology companies like that, I want to tell you that those companies haven't got any of the answers when it comes to workplace culture. Generally, what you find is that, you know, if you see an organization that's built loads of nice looking things to photograph, generally they're trying to distract you. So Silicon Valley companies most definitely haven't got the answers when it comes to workplace culture. But also, I reckon and I recognise that a lot of us are fed up with some of the ways that our organisations work and some of the culture that's created. So more than anything, I was interested in specifically when it does work, what is the secret of good workplace culture? So that's the position I'm starting with. I'm actually also going to briefly look at that sort of tiresome thing that we keep hearing about, resilience. And a friend of mine works at the emergency department, the A&E department at the Whittington Hospital in North London, and she says if any of her colleagues hear the word resilience again, they will thump someone. So I'm going to sort of have a look specifically at why resilience is a bit of a hoax. So I'm going to try and cover those couple of things. So I mentioned right at the outset, I'm going to try and give you a perspective of some of the research. And there's a couple of key parts when it comes to thinking about resilience. So there's a couple of key elements that sort of can help us. Broadly, when we talk about workplace culture, broadly there's two key components of workplace culture. The first one is the idea of positive affect, and the second one is something called psychological safety. Both of these heavily researched in medical environments, in fact. So I'm going to sort of give you a perspective on those in a second. So let me go into what each of these are. So it's positive affect rather than effect. And it's a psychological term, but I'm also going to talk about psychological safety. So let me maybe start with that one. Psychological safety. The work that was really done on this was done by a psychologist, a woman called Amy Edmondson. And she studied in hospitals. So firstly, she was interested in what makes good performance, specifically in different hospital wards. And she gathered loads of data from loads of hospitals, American data, but when I go into the details, you'll see why it's internationally translatable. She went in and she was really interested in the idea that she could track performance in hospital wards based on various different metrics, various different measures. And what she did, she went in, she tracked all manner of things, and she had a wonderful little correlation. And just as she was finishing her research, she added one more piece of data, which was the amount of drug errors, medicine errors in these hospital wards. Now, everything else had been predictive of the best teams were getting the best results. When she loaded the data in from drug errors, though, she found the opposite. She found that the best teams weren't making the fewest mistakes. The best teams were making the most mistakes. She was really interested in that. Why would the best teams be making the most mistakes? In fact, to just put it in sort of a measurable term, the best teams were making about twice as many mistakes as the average team. So, these were sort of significant margins of error. Why would that be? Well, what she found was actually when she went and chatted to nurses, when she went and chatted to the people who were working on these wards, there was a slight misdirection in the evidence. The best teams weren't making the most mistakes. The best teams were admitting to making the most mistakes. Sort of fundamental different. The best teams were admitting to making more errors. Because if you imagine, we've all witnessed these environments. If you imagine you're maybe a agency nurse, or you're a starter nurse, trainee nurse, and you make the wrong mistake of giving the medicine for bed 4 to bed 5. You've got two choices. You either go and tell someone what you've done, or you maybe contemplate the consequences of what you're doing, and you choose not to do that. And here's what happened. If you're in an environment that didn't have this killer word, then this killer phrase, psychological safety, if you didn't feel you were able to be honest about what happened, you didn't tell anyone. Now, these wards that had good results, they had high psychological safety. So if a mistake was made, people admitted to it. Now, this became sort of an interesting phrase. And what was discovered was when you looked into good performing environments, they did have this high psychological safety. So even though errors might be taking place there, like they take place everywhere, people were more candid about discussing them with each other. Really interesting sort of idea. What's gone on over the last few years is that we've observed that this has had a really big indication, a really big impact on the work that gets done. So Amy Edmondson went and did some more work. Now, one of the things that I suspect you're aware of is the amazing transition about 20 years ago in open heart surgery, when open heart surgery was far more invasive, when it involved breaking ribs and a sort of very invasive procedure. The survival rates were really low, and not only that, the morbidity rates, the sort of depression rates of people in advance of operations was also pretty high. What Amy Edmondson did is she studied the teams that were implementing a new method of open heart surgery about 20 years ago now. And what she did is, we'll know this is the main form of open heart surgery now. It's a procedure that takes place in someone's leg and tiny incision in their chest. The first people who did that operation thought it was a wild and crazy concept, that they didn't necessarily know it was going to work. What Amy Edmondson did, she's the academic, she went in, she studied different teams as they were coming to terms with that new way of operating. What she discovered is that all the operating teams looked functional. It wasn't like you'd walk into some of them and some of them looked great and some of them looked awful. They all looked functional. But what she discovered was that there was that absence of psychological safety, or that presence of psychological safety, played a really big bearing on what happened next. So if operating teams had high psychological safety, what that would look like is that the people were comfortable saying what they didn't feel was right. So in an operating theatre, normally if it had high psychological safety, the surgeon, clearly loads of experience, loads of qualification, but because of that, he's often at the top of a hierarchy. The surgeon would say at the end of an operation, first operation of this new method, listen, we're all going to stay behind afterwards. Everyone, I want to hear what you felt went wrong, what went well. What you discovered was, the first operation is everyone would say to the surgeon, I couldn't see what was going on. We couldn't see a single thing. Apart from him being able to see inside this tiny incision, we were clueless. We felt a little bit terrified. And so what happened in those environments is those environments with high psychological safety, the surgeon said, let's get Let's ask if we can get some cameras. Let's ask if we can get a screen. Immediately transform the environment. That's the high psychological safety. The low psychological safety, well, look, it didn't look dysfunctional, but everyone felt like they didn't really know what was going on, and the operation felt a degree chaotic. What happened next was really interesting. The teams with high psychological safety, so you've got to imagine this prior form of surgery had a really low survival rate. About half of all patients didn't make it through the survival after the operation. Now they were switching to a new form of open heart surgery that had a massive survival rate. So the people who were doing this, who were getting it working well, felt a fairly evangelical about the way that they were doing it. They felt like, wow, we've done these operations, the patients are surviving. Actually, we feel like this is an incredible gift. We're on a mission here. After 5 or 6 operations, they started requesting more difficult patients from the list, patients that were considered borderline inoperable. In contrast, the teams without psychological safety started saying, we're not even sure this is safe. We're not convinced this is working well, because there was no feedback loop. And that's the critical thing. Amy Edmondson, so the woman I mentioned, she said, for fear of appearing ignorant, we often don't raise our concerns, or we don't ask questions. For fear of appearing obstructive, we might not say what we're really thinking. So it's a really critical element, I think, that psychological safety seems to play a really big bearing in terms of how we interact with each other. Psychological safety then, broadly, how would I summarize it? It's our ability to speak candidly to each other without fear of consequence. And I mentioned these 2 elements. There's that psychological safety, but there's also that second element there, that positive affect. So what's positive affect? Well, positive affect is effectively related to something that we all instinctively understand. So positive affect is the idea that our frame of mind has a bearing on the way we conduct ourselves actually in our jobs, the way we get things done. So I'll give you an example of it, a classic example of it. Over this weekend, if you were around maybe if you're around children or you witnessed other children around, you'll know that children have got a really clear understanding that the mood someone is in has a bearing on the decisions they make. So they know that if they want to get ice cream, if they want to get treats, they need to put the person who makes the decision in a good mood. Now, strangely, we sort of forget that information when it comes to us doing our jobs. So what's positive affect? Positive affect is the frame of mind we're in. And the notion of it, why it matters for workplace cultures, is the frame of mind we're in has a bearing on the decisions we make. It has a bearing on how cooperative and collaborative we are. I'll give you another example from a medical environment. This was performed by a pioneering psychologist, a woman called Alice Eisen, and it was a few decades ago. But she went into sort of different domestic environments before she went into hospitals. She went in, I'll give you one example here. She went in to, she did something involving payphones. Now, I guess we're just at the border of most people knowing what a payphone is, but I recognise that in the next couple of years, I'm going to have to explain a bit harder what a payphone is. But so she did this experiment where she phoned people from payphones. So reminder, coin, you get one chance to get the number right. If you dial, you get a wrong number. You've lost your coin. So Alice Eisen did something where she phoned people from payphones, and she wanted to know, would the way that people responded to the call change based on the mood? So she went round, she knocked on their doors, she gave some people who were receiving her call, she gave them a free gift. We're in the neighbourhood, we want to give you a basket of free product. Then they would get this wrong number call. Other households didn't get that basket of free goods. What she discovered was the people who'd received the basket of free goods were far more generous to the wrong number call. So the wrong number call was someone saying, oh, hi, I'm trying to get a hold of my brother, he's coming to collect me. Oh, I've used my last coin and I've dialed the wrong number. If people were in a good mood, generally what she found is they'd say, why don't I take the right number and why don't I pass on a message for you? Because they sort of responded in a different way. And it was a really interesting experiment. Alice Eisen then went into hospitals. So she wanted to see if this had an impact on the way that people did our jobs. She went and she gave a bag of 10 sweets. It was like 6 chocolates, 4 boiled sweets. doctors and the medical staff weren't allowed to eat them, so it wasn't about a sugar rush, but she wanted to know if she gave something to people, if she changed their mood, would they change how they did their jobs? Absolutely. What she discovered was the doctors who received this gift were more patient in their diagnosis, they took more time on it, and they reached a more accurate diagnosis than those who didn't. Really interesting. So I guess the frame of mind we're in has an impact on how we do our jobs. And look, you know, why any of that's news is not necessarily because of positive affect, that we're in a good frame of mind, we're able to do a more constructive sense, but in the opposite. You know, if there's positive affect, then there's negative affect. And what's negative affect? It's burnout, it's overload, it's being overwhelmed. When we feel like we don't have the resources, the time, just the space to do our jobs well, that negative affect can have a bearing on the way we do our jobs. So look, when we're thinking about workplace culture, these things play a critical element. Actually, I'll go a little bit further on that, actually, because, you know, just while we're sort of in the spirit of looking into the research, looking into the evidence, there's some really interesting evidence about how our frame of mind has a really big bearing on how we do our jobs. Now, look, actually, we might all have experienced this, but it's interesting to have the evidence there. So the evidence here is work by a pioneering sort of psychologist about operating at the end of the 20th century, really, a guy called Yak Panzep. Now, Yak Panzep at the time was doing all his neuroscience. He was doing it on rats. So he did this experiment with rats where he wanted to understand the impact of different motivations on our brains. So what he did is he looked at rats and he said, okay, I believe rats have got, like all mammals, have got these different systems operating in their minds. So he said, like, they've got one of the systems, he said there were 7 systems. One of the systems is called the seeking system. So what the seeking system is, it's like a desire to discover new things. It's, you know, exploration. So he said, I'll give you an example. When you think about rats, if in 5 minutes, tracking rats in a cage, 2 rats in a cage, he said they show 50 instances of this seeking. That's biting things, testing things, pulling things, 50 instances of this, effectively, of this creativity. But he said there's other systems operating in rat brains as well. And so, you know, one of the systems is the fear system. He said there's a system for mating. There's all different systems operating. He wanted to know how they operated in hierarchy. So what he did is he put some cat hair in the cage with the rats. He said they went from the 50 instances of that creativity, of that seeking, of that exploration to 0 when the fear system in their brains was activated. Now, these are rats who've never seen a cat. You know, it was just a system that was effectively, there seemed to be some hierarchy. And that's a really critical element, because our brains, as far as we understand it, our brains don't necessarily interpret different signals completely differently. Fear, anxiety, stress are all interpreted by the brain to some extent in the same way. So effectively what you're saying is when we feel stressed, overload, maybe anxious, we're not necessarily going to be activating the part of our brains that are more problem solving, that are more connected to try and find solutions to things. Here's someone saying broadly the same thing. This is a quote by Gregory Burns from Emory University. The most concrete thing that neuroscience tells us is when the fear system of the brain is activated, exploratory activity and risk-taking are turned off. That's really interesting, because if any of us are thinking, you know, I've been tasked by someone to get something done, I've been tasked by something, then we might recognize, actually, I used to be much better at this. I used to be much more able to get these things done. I think it's important to sort of think about those things, how these stresses on us do seem to have an impact on how we get our work done. I always think about that when I think about sort of, you know, our favorite musicians. Their first album may be unencumbered by any stresses and anxiety, becomes a massive success. All of a sudden, their second album, or maybe a writer and their second book, just feels a bit more restricted. It doesn't have the same abandon to it. Why? Because the stress that's operating in their brains is sort of preventing them from accessing that inventive creativity that happened before. Really helpful, actually, I think, when we sort of start thinking about the impact of work on us in all those ways. We start thinking, actually, you know, it's no wonder then that our jobs at times can feel overwhelming or exhausting. Actually, the demands on us are too much. There's really interesting evidence, I think, if we are trying to understand that burnout, that negative affect, it's really interesting evidence that our brains are sort of far more like the batteries on our phone than these infinite, never-ending supply of ideas and cognition that we sometimes pretend they are. So I'll give you an example of that. Quite often we find ourselves thinking, I'm going to be as productive to open my email late in the day as I am in the morning. Whereas actually the evidence isn't really for that. Hospital errors are 4 times higher at 4 p.m. than they are at 9 a.m. Why? Because just innately our brains, once they've dealt with more stimulus, they generally react in a less productive way. Probably the best example I can give you of this is there's a quotation by someone who wrote a book about 5 or 6 years ago now. But this quotation summarizes what we know about sort of the finite capacity of the brains. This is a quote by a guy called Daniel Levitin. He says, our brains are configured to make a certain number of decisions per day. And once we reach that limit, we can't make any more, regardless of how important they are. That's really interesting for me, because that is not the lesson that we sometimes tell ourselves. And look, we're all a bit guilty of that. If we've all spent time in our lives studying, or we've spent time sort of trying to get stuff done at the last minute, we kind of tell ourselves that we can get stuff done, and we've just got the ability to sort of deal with whatever's thrown at us. Actually, when you look into the evidence isn't that. So our brains are configured to make a certain number of decisions per day, and once we reach that limit, we can't make any more, regardless of how important they are. It's kind of not the lesson that we tell ourselves. So I guess, when any of us are thinking about work, when any of us are thinking about the environment we're in, understanding those things is really critical. So I've given you sort of a couple of big pillars about workplace culture. First one is that idea of psychological safety. Second one is that idea of positive affect, the frame of mind, the sense of overload that we might have in our jobs. Now we need to go on and think about how these things work together. And generally what you find with strong workplace cultures is that they've got one thing that sort of characterizes, that runs through them. And it's a sense that it's a sense that we're all in this together. Sort of really sort of critical, that a sense that actually, the rules are sort of consistent and they apply to all of us, and we're all in the same boat. And it's really interesting to explore some of the evidence that sits below that. I was chatting to someone who works at the United Nations, and he said to me, "Oh right, actually that's very consistent with what the UN looks for. When the UN goes into a new country, or they're setting up, they're reflecting on the way they operate in a different place. One thing they always think about, they ask themselves the question, is there social cohesion in the place? Is there a sense that actually people feel bonded to each other, and people feel like they're all in this together?" And actually, when we look into the evidence of this, there's really good evidence of this. Look, not to go into the ins and outs of things in the law, but when we see something that we don't necessarily think that there's a sense that we're all in it together, it's got this innate sense that people can get inflamed by it. Or, let's look at other examples. Actually, great leadership moments are when there's a sense invoked that we're all in this together. So look, Vladimir Zelensky there on the right tries to evoke this sense that we're all in this together. And it works because anyone consuming that message thinks, oh, we are all in this together. Or you see examples just taken from the news, but you see an example of Vladimir Putin, who's so focused on the sense of trying to be a commanding, strong leader. He's trying to project strength, that sometimes he neglects to think, actually, the thing that we buy into is the sense that we're all in this together. Give you another couple of examples. So this is some work done by some brilliant social scientists. A guy called Alex Haslam and one of his colleagues, Nick Steffens. He looked, so this is a societal level, but they looked at all of the elections that had ever taken place in independent Australia. And they found that the candidates who used the phrases we and us more were elected 80% of the time. Some parallel research was taken looking at people doing their jobs, and it found that when workers talked about the leaders are a good reflection of the people who work here, when I think about our organisation, I talk about us and I talk about we. When those things were characterised in the way that people talk about their jobs, generally their stress levels were lower and they felt more connected to the jobs. So these things really strongly have an impact on the way we do our jobs and the way we experience it. I think it's really critical. If we're thinking about workplace cultures, then workplace cultures generally have a sense that we are all connected. There was some brilliant work done studying studying retail stores and sort of big supermarkets that had good cultures around the world. And one of the things that was discovered was that generally when workers felt that their bosses would do the jobs that they would do, and they felt that their bosses understood the jobs that they did, there was a strong sense of connection, a stronger sense of culture. So it's really intriguing. If we're going to try and understand good cultures, actually understanding these pillars, understanding the science that goes into it, these are incredibly helpful. I just wanted to touch, I know I recognise we're running, we've probably got sort of 6 or 7 minutes left. I just wanted to get into that other thing that I talked about. And I mentioned right at the outset the idea that, talk about resilience. So I've got like I say, a friend who works in the A&E department at the Whittington Hospital. And she said to me, everyone is so fed up hearing about resilience. And there's just a really interesting thing about resilience is that resilience is very much sort of a trending word that's used about, I think I tried to measure it, it's used about 3,000% more now than it was 5 or 6 years ago. So like it's massively sprung up, and it's largely because it's quite a convenient word to use. There was an article in the New York Times last week. Last week there was a sort of a lone gunman incident that happened on the subway in New York, and one of the commentaries around it was that New York is an incredibly resilient place. And someone in the New York Times, New York Times article this week said, "Sorry, what choice do we have? Should New York shut for business? Should New York say, actually, we're not dealing with this anymore?" And I saw something similar to this when I was in Beirut about 2 years ago. My partner's Lebanese, and so we're over in the capital of Lebanon a couple of years ago, and there was this huge, colossal explosion sort of ripped through the center of the city, caused by ineptitude, chaos. The country had already sort of pretty much gone bankrupt 6 months before, and it was ripped through. But there was something strange. The BBC, in their coverage of it, the BBC said, well, if we know one thing about the Lebanese people, they are resilient. And then again, a sort of an American newscaster said, well, anyone who's been to Lebanon will know they are resilient people. And you just hear this word over and over again. What you discover is with resilience is broadly the way we've come to use it. It's a way to shoo people away who've maybe been at the wrong end of some experience. It's like, just go on and deal with it, please. I was on a radio phone in with Robert Peston, the ITV journalist, and we were talking about the A-level results that went wrong a couple of years ago, just after that explosion, in fact. And Robert Peston said, well, so to put this in context, children who'd been studying for 11 years, just got their A-level results, the things that they've been dreaming of for the majority of their life. Children who were going to state schools saw their results massively undershoot what they'd expected. Children who'd expected AAA had received DEU. Sort of brutally unfair, it seemed. And Robert Peston's response was, well, I think these kids need to be a bit more resilient. Wow, and it's an illustration of how this word is used. This word is generally used when people don't want the thing we're talking about to be their problem. Now, actually, can you be resilient? Most definitely you can. Absolutely you can be strong. But what you discover with resilience is it isn't this individual magical trait that some of us have and some of us don't have. Because look, we talked about Ukraine earlier. And look, the one thing that I think anyone would say about the people of Ukraine is that, my God, they've got a really inspiring sense of resilience. We actually see this sense of strength, this sense of power. We see it exhibited in war times and natural disasters. But I think it's a critical misunderstanding of what we're looking at. What you discover with resilience is that it's got these 3 critical components to it. And quite often they're absent, or leaders, bosses, organizations, governments don't necessarily help us achieve those things. So actually, when we look at resilience got these three components. Firstly, a sense of personal control. Secondly, a strong sense of identity. And third, a sense of connected community. And the community part is the most critical part. So what do I mean by it? Well, firstly, you're never going to feel resilient if you have no control. If you feel overwhelmed, if you feel you have no control over your calendar, if you feel like you're given no resources, then this is the single biggest determinant of how we live our lives. People who feel an absence of control feel helpless. They feel unable to get things done. So you're not going to feel resilient when you have no control over anything you're faced with. It's a really critical component. Actually, if our organizations want us to feel resilient, then providing that sense of personal control is really critical. Secondly, enabling a sense of identity. And I really witnessed this. I studied a long time trying to understand maybe some of the elite athletes that we see winning Olympic medals and what they accomplish. And what you find about it is that quite often they've turned their misfortunes in life, or the bad things that have happened to them, they've directed that energy into saying sport has become my identity. It's why you get really remarkable stories of people who have experienced extreme trauma in childhood are able to achieve incredible results. Is because they funnel it through their identity. I was reading something just a few weeks ago. Barack Obama was talking about the transformation that he'd gone on in his life. And what he said was that actually he'd been pretty directionless until the age of 19, 20. His father, who he'd only met briefly once, his father was studying, and he'd only met his father briefly once, and his father was killed in a car accident. And he said at that moment, it was a catalyzing moment where he realized, I need to be someone and become something. Identity was this really critical component. But the most important thing to resilience is this idea of connected community. And when we think about the people of Ukraine, the reason why they're so admirable is not because any of them individually on their own could summon up this resilience. No, far more. They feel like they are at one. They're together. They're all in this together with the people around them. And that all in this togetherness actually proves to be their strength. So I think, I'm always cautious as that person interviewed in the New York Times said, that when you hear the word resilience, what choice do people have? And quite often when you hear the word resilience, you kind of have to ask yourself, what's the motivation for the people asking you to perform it? Generally, you can access resilience. Resilience is a critical thing, but resilience is often about feeling supported by the people around you and feeling that you've got the control to have an impact on the way you're living your life, you're doing your job. So I think, quite often kids can be told, you need to be more resilient, or we see evidence that people are sort of being instructed, oh, your job is to be more resilient. And actually that in itself can make us feel helpless. But how on earth am I meant to feel more resilient unless I'm being provided the tools to do it? So just a cautionary note when it comes to resilience, and actually that's a critical component to the cultures that we build. So look, what have I tried to do? I've tried to sort of give you a sense. I mentioned right at the outset that I found myself working at those technology companies and realizing they had a disastrously bad culture. And I found myself thinking, well, hang on, if the culture's bad, is there a way to fix this? Is there a way to make it better? As a result, I found myself delving into the incredible psychological work that's done, study of organizational culture, and you'd find absolutely, it's no surprise that some places you've worked have got this great energy, or some teams, it's often at the team level, some teams have just got an incredible vibe to them, an incredible sense that everyone's connected, and others don't. And that's largely pinned on that sense of psychological safety, or it's pinned on that positive affect that people are feeling like they're in a beneficial frame of mind. I think thinking about all of those things combined with a sense that we're all in this together can be a critical sense that there is a strong culture. So like I say, plenty of evidence from the world of hospitals, the world of medicine that tries to understand this. And hopefully I've tried to a breakneck speed whiz you through some of the evidence for that. So I've completed 30 minutes talking. It's probably high time I let people ask a few questions if that's what people have got. Thank you very much.
Lovely, thanks, Bruce. Thanks so much for talking us through all that. I think, you know, as we said at the beginning, if anyone's got any questions, pop them in the chat or pop your hand up and we'll come to you. Just a couple of observations from my perspective. You talked about supermarkets, and that resonated with me a little bit. I think in terms of within the NHS and within hospitals, there are a lot of different teams with a lot of different pressures, a lot of different priorities going on. So how do you ensure that, if you've got so many different teams and different pockets of staff and management styles and priorities and challenges, how do you ensure that that culture manages to get through all those different groups of people and those different management teams?
Yeah, look, you know, quite often the evidence suggests that more often than not, we all know in our job, we know the things that would help our job do better. You know, quite often if we feel in our situation, we're like, actually, if management did this, it would get better. If management listened to this, it would improve. So to some extent, that's that psychological safety that I mentioned in action. You know, that sense that actually, if we were given a voice here, it would help us. I did some work with the police, the Surrey police recently, and you know, one of the things that they are really intent on trying to do is make sure that they give a voice to the people working there, because they recognise that, you know, the police recognise they've got at a high level, they've got some cultural challenges, they've got things they need to get better at. But in addition, they want to make sure that they're listening to the stresses of the job. They're listening to some of the experiences of the people there. So it's a balance, is really critical balance. But taking steps, you know, even if it's just in our own team, or even if it's just with the 2 or 3 people we work with, in trying to, in a positive, productive way, share our voice and try and work out what would be the things that improve this, seems to be, in that research, seems to be the most productive thing that any of us could do to improve the direct culture we've got.
So just in the chat, Michelle Bone has popped her hand up. Do you want to turn your camera and your microphone on, Michelle, and ask your question?
Yeah, thank you. So excellent presentation, thank you. I've moving on and thinking about resilience. You said some key points regarding staff feeling supported, having some tools in their kit box, being able to have some control over their working day, for example. Within some elements of the NHS, so I'm a nurse but currently work quite administratively, so I am able to have a lot of control. For people that work on a ward, perhaps shift-based, etc., what evidence or guidance would you give regarding supporting those individuals? Because things have to be done perhaps at certain times, etc. So for them, control may be really difficult for them to have any control, I suppose, and then in turn resilience. And perhaps now we're coming, in theory, out of COVID, those sorts of issues are now more at the forefront for individuals, that they do feel they have no resilience left, I suppose. Absolutely. Your thoughts would be welcomed.
Absolutely. There was some wonderful research studying Scottish nurses, actually, trying to understand what was the sense that, when was the sense of when they got completely overwhelmed? What were the triggers that sort of led to them feeling like they were completely done in? And what was discovered in that research was that actually it wasn't necessarily the hours they were working, in this research at least, it wasn't necessarily the hours they were working or the intensity they were working, it was whether they felt they just had any control over how they were doing their jobs. So again, you know, like it does seem to, so, you know, in that spirit, it's been found with bar workers. If bar workers choose to do another shift, if they choose to do that work, they exhibit lower signs of exhaustion than when they're forced to do it. Now, look, I recognise that that's an easy example, but what it sort of leads us down a path towards is thinking, okay, if there's any scope for us in our teams, in our setup, in our schedules, in our environment, to say, look, these 10 things that need to be done this session, but do them, just make sure they're ticked off by the end of the session, the shift, or actually you might want to just think about amongst yourselves, what are the things to do? Any degree of personal autonomy seems to have a payoff in people feeling like they're not just sitting there overwhelmed. Look, any of us who've got electronic calendars and we do any sort of officey work, sometimes your calendar feels like it's the most inconsiderate accomplice. It's like, well, you know, it pops up you an alert, you're meant to be on a meeting right now. It's like, how am I meant to do that? And it's that sense that we feel like we've not got any control over what we're doing. You'll recognize that there are times you just feel overwhelmed by things. Whereas sometimes, you know, you want to get something done, give it to a busy person. Sometimes you can be on fire, ticking through stuff. All right, I'll do this after they do this. And it's, you know, it's sort of it's a luxury of the person who's ticking through it and they're in charge of it. There seems to be something in the way we experience it, you know, like if someone's giving you orders and then giving you instructions, it seems like our experience of that is way worse than us being on a sort of a busy clip. So look, you know, I would say I recognize how challenging it is. There's no easy answers to this. You know, actually, what you find is the best cultures, those supermarkets, were the ones that there was a bit of slack in the system. There was a moment where you could sit down and have a cup of tea. Not that you necessarily, you know, you're not doing something, but a bit of slack in the system, policing or witnessing it as well. When there's some slack in the system, generally people can do a better version of the job just because it gives them a breather. My friend who works at the Whittington, she says, look, it's just that sense that occasionally you could put your feet up at 5 a.m. and have a cup of tea and a chat. Actually, it makes every aspect of the job more manageable in another way. So it's just sometimes a sense of slack or a sense of, you know, occasionally this scope for a breather. Easier said than done, but at least sort of when we know what the pointers in the research are, we can think about, okay, well, maybe we could do that a bit more flexibly. I don't know. It's sort of easy theory, but like that's what the evidence says.
Thank you very much.
Thanks, Bruce. And I think Anna Redwood's just added in the chat, sometimes it's something small you can influence when there's lots of things you can't control. And I think, you know, that's right, that making that tiny change can really help, can't it? So just a couple more questions in the chat. We've got one from Pratima Datani, who says, thank you for your talk. Could you please say something about the joy of work in relation to organisational culture, especially post-COVID?
Yeah, you know, probably the big thing I would say is that, you know, what we've found during the pandemic is that, you know, people have been focused on aspects of their job or the product, you know, just getting their job done. And I've mentioned, you know, the freedom to, the autonomy to operate in the way we want can be really helpful. But, you know, probably what we find organizationally, the big change is that there's a lower sense of connection. And there's a lower sense of sort of rapport between individuals. You know, I would say, look, you know, anything that builds, actually it's back to what I said, you know, anything that builds the sense that we are together in often a social sense helps. So, you know, sometimes that can be the things that we were more comfortable with previously, or there was space for us to, you know, if someone turned up with some cakes on a Thursday afternoon, you know, our instinct might be, if someone wanders past and sees us sitting, eating cakes and drinking tea, when there's the time for that, which is our instinct might be to think, oh, it looks like we're not doing anything. And what you discover is that actually those connections between people have more than their weight in sort of the upsides. I did some work, some great research with people who work in call centers. Now, I know you might say, oh, well, my job's not in a call center, but here's what they discovered about call center workers, is that call center workers used to be sent on breaks on a staggered rota. So the person here would go on a break, then the person here would go on a break, then the person here would go on a break. And what they said was, look, there's 1,000 people in this call center. Why don't we just send people on a break with the 30 people who sit near them? Right, so there's enough people to cover the calls, but it's just, actually we're going to send them in a social break rather than an individual break. The old version of the break was they would all go and sit in a sort of lunch room, scroll through their phones, go, you know, have a cigarette or whatever they're doing, go back and sit together. The new version was the person next to them would come along, and what they discovered was, so, you know, it might seem like a really trivial difference, but what they discovered from that was that stress levels went down, productivity went up, people felt supported by those who sat around them. Really trivial difference, but it's almost like we can forget that connecting with other people, it feels like it's sort of, that's not the job, you know, chatting to someone on the job, that's not the job. Whereas what you find is that sense of support that you get from building a strong bond with the person who sits next to you, the person who sits across the office, you know, often has one of the biggest impacts in people feeling a sense of belonging in their job. So I know sometimes it's like those social things, you know, can feel like a distraction from the job. But when we look into the sort of the people who measure these things, they say actually that has a really strong uplift in terms of the way people feel like they're all pulling in the same direction. And I think that's to some extent, you know, through the demands of the last 2 years, through the strange way of working the last 2 years, where people wandering around with masks on the last 2 years, those things have sort of pushed back on what might be sort of easily dismissed as soft parts of the soft skills. They have a really big bearing on our experience of work. Right, number one predictor, if someone is engaged with their job, the number one predictor, if someone feels connected to their job, is whether they have a friend at work. Right, that feels like, well, how's that related to them being connected to their job? Because we're all humans, and actually feeling like we're in it together with people we like has a really big bearing on our experience of our job.
Thank you. I think certainly as somebody who's working mainly from home still, that completely resonates in terms of relationships. So we've got another question from Anamika Joshi. So you talked about the 5 pillars of organisational culture, and she was just asking, she's noted down 4, and we just wanted to check what the 5th one was. So we've got psychological safety, positive effect, we're all in it together, resilience, and what was the 5th one?
Yeah, I didn't mention a 5th actually, so sorry, that must have been me misspeaking. But yeah, those pillars, I think I wouldn't necessarily club resilience into it. I just, you know, for me it's those 3. We're all in it together: psychological safety, positive affect, resilience. I just wanted to sort of have a brief word on, because it's so overused, you know, and generally what you discover, there was something that happened a few years ago actually with West Dorset Health Authority, and you know, actually West Dorset Health Authority, they had the health and safety executive come in and say that it was an excessively stressful working environment. 2003 this was, and the consequence of that was West Dorset said, well, actually we don't think it's a toxic environment. We believe that our workers aren't resilient enough, and they sent everyone on resilience training. And that's the cautionary note I'd give you, is that, you know, quite often the notion that somehow it's wrong, something wrong with us, rather than people don't feel this sense of control or connection. Actually, I think sometimes we can make a mistake on it. So look, you know, I've no doubt in the last 12 months, pretty much everyone in every organisation everywhere in the UK has been offered resilience training. So I recognise that, like, it's everywhere around us. But I think, you know, my take is sometimes we should take pause and say, look, rather than resilience training suggesting that there's something wrong with us, actually we probably need to foster a stronger sense of connection and between us, or surrender back some control, some slack to people to get their jobs done.
It's really easy, isn't it, to tell people to be more resilient when actually you might need to speak up and get some more help. It's not about just shouldering it all and being resilient, so to speak. It's a real challenge.
Someone told me, the guy who came to fix my Wi-Fi, he said, never in the history of calming down has someone calmed down by being told to calm down. And resilience, I think, is a bit like that. Never in the history of resilience has someone been resilient because someone put a poster up saying they needed to be resilient. It's like, it just doesn't work like that. There isn't a switch. It doesn't work like that.
Exactly. So Zakia Luffhead's put a comment in, and she's talked about a conflict between pay and conditions that can also relate to culture, which is probably quite profound in the public sector and the NHS. So how do you value the team in both the team culture, but also in the salary and the pay and terms and conditions?
Yeah, I'm not sure. I mean, look, you know, I think critically feeling like our work is valued is a really core component of us getting reward from our job. And so, you know, if we don't feel that our work is valued, so that might be we spent ages preparing something, you know, we do it, we send it over to our boss, and our boss says fine, and you know our boss hasn't looked at it. Then what we generally find in that is we don't feel our work is valued. and paying conditions is an element of that. If we feel our work isn't valued, then it sort of goes to the heart of our sense of self-worth. So look, plays a part in that, and I fully empathise with the challenges of that.
Well, that's all the questions we've got. We did have a hand up, but it seems to have gone down. So if I've missed anybody, pop your hand back up. But otherwise, it looks like that's all the questions we had. So thank you, Bruce, for that really interesting.
Thank you so much.
45 minutes or so. So obviously, as people that have attended these calls before will know, feedback is a gift. So there will be a Slido popping up shortly. My colleague Louise will be sharing that with you to give us some feedback in terms of how today's leadership conversation has gone for you. And then the link will also go in the chat. I think we've got some problem with some slides to be honest. And just to make people aware of the next Leadership Matters conversation, which has been held on the 24th of May around reverse mentoring. So Stacey Johnson is joining us to talk about how reverse mentoring can develop the cultural humility of leaders and motivate them to act against injustice and discrimination. And she'll talk about the work that's been done at Northamptonshire Healthcare Foundation Trust, who have been tested out the remedy framework for reverse mentoring, and that has now been used for more than 2,000 reverse mentoring relationships, which is incredible. So that will be on the 24th of May. The details will be coming out. Louise, if you could pop the Slido in the chat so that people can pick that up, because I think we've got some issues with the slides, like I said. And otherwise, can I just thank you again, Bruce, for your time today, and thank you everybody on the call for joining us today. And hope you have a lovely rest of the week.